Hi, and welcome to another session of the Clinical Tips with Dr. Jin Kim. I'm Dr. Jin Kim. I'm a board-certified periodontist practicing in various parts in Southern California, United States. Today I'm going to talk about the connective tissue graft. A connective tissue graft is something that a very typical periodontist would be doing in a very routine manner. Connective tissue graft is one of the many procedures that try to cover the root surface that's exposed, try to thicken the tissue around dental implants or teeth, or there are a number of different applications of this very convenient method in soft tissue plastic surgery. Root coverage is one of the main ones. In this example, we have a case where old bridge that was created on a receded tooth surface was reconstructed with a connective tissue graft. The image on the right side is what's called a pre-prosthetic case where crown and bridge were done in this gentleman, but the soft tissue was done soft tissue grafting was done to make the tissue healthy prior to doing that procedure. The case I'm about to describe is a 45-year-old female who's otherwise healthy. The reason why she was referred to me as a specialist by her general practitioner, general dentist, was the fact that she was displaying a number of areas of recession and soft tissue loss. You can clearly see on this image how on the patient's right, that's our left, on the screen, the canine tooth is a little bit longer than the corresponding one on the other side. And when you look at them side by side, you can clearly see the big difference. But before we go there are plenty of other hints as to why this person is suffering from what we loosely call an occlusal disease. That is a condition where heavy bite forces are introduced to this environment that is quite destructive. So gingival recession, or gum that's being lost, as we see on the patient's right side, is an aftermath of heavy bite forces that not only destroy the bone and the gums, but it actually puts physical wear on the teeth. And pay attention to what you see at the bottom of the screen. At the bottom, there's a reverse relationship. Whereas the upper teeth are losing bone and gum, the bottom of the screen shows how the bone has thickened as a result of this unusual bite forces that is causing all of these unusual phenomena. When we look at the patient's radiograph, we see that she has a full complement of teeth. The third molars, or the wisdom teeth, are gone at this point. But please note the biting surface of the patient's teeth. If you look at the back teeth in particular, the surfaces are very flat, unusually flat for the patient's age. And this is, again, due to the unusually high bite forces, clenching habits that the patient possesses. So let's take a look at her facial appearance. Here we can see the chin is a little bit short. The teeth have been worn, and therefore the teeth are what we call over-closed. But what is also clear is that she has much heavier musculature. The muscles that do the work, the normal work of chewing function, is exaggerated in this situation, and that unfortunately is causing a lot of serious damage to the surrounding structures. This is a short video that describes what we're talking about. Take a look. There are a number of areas where the bone is unusually bumpy, especially the lower front teeth. There are areas where our main concern, the upper right side, the gingival recession, the gum recession, and the subsequent bone loss. But also pay attention to the teeth surfaces. Both upper and the lower teeth are extremely flat. The lower front teeth are short and flat, and as a result of that, the lower teeth are not quite visible in this relationship when the upper teeth overlap. The lower teeth are almost not visible And again, this phenomena that the patient is over-closed, making it an exaggerated bite force. So this is the area of interest where we see practically all the teeth in this view have a degree of recession, the gum missing, and therefore the roots being exposed. But when the roots are exposed, it really means that the bone is damaged underneath. And again, some severe root exposure in these teeth in the image. So here is the side-by-side view of the bottom image, which is the intraoral scan. This is a digital scan of the patient's mouth as is, including the soft tissue. And the image on the top, that's the CBCT, cone beam CT, where the soft tissue is not visible on that x-ray. It is the bone that is being depicted. You can clearly see that almost all the teeth in view, except for maybe the two front teeth, have lost a significant amount of bone that is not readily detectable when we don't see this x-ray. On this opposite side, which we will be treating down the road, we can see that the tooth in the center of the screen, the first bicuspid, the one behind the canine tooth, has significant amount of bone loss, and that is displayed on the x-ray as well as the intraoral scan view. So it is quite important to correlate x-ray views with what is the superficial view. So this area in question, let's look at the three teeth involved, the canine and the two premolars. Both of the premolars display root exposure, gingival recession, and the x-ray substantiates that by showing how much bone is missing. The interesting one is the canine. That's the tooth on the right side of the screen. It really has very thin bone remaining. It doesn't look like a lot of recession, but a lot of the bone has thinned. And the next view is the tooth in front. And I have a cross-section of the tooth, which is a lateral incisor, which is in the center of the clinical picture. But the cross-section of the CBCT, the three-dimensional x-ray, tells its own story. Not only is the root short, but the amount of bone that remains is very, very limited, therefore adding to the anxiety of how long is this whole situation going to last. I've included this three-dimensional graphic just so that the viewers can understand what the bone, soft tissue, and the root surface all come together, a little bit of a sort of a graphical understanding. So let's go back to this situation. We're going to be treating this whole area. In fact, I'm going to be treating 3-4 teeth in a row in this case. And the graphic, the cartoon figure shows how unusually the bone is gone and the soft tissue is gone, and that depicts how the bone is clearly missing in this situation. So tissue was harvested from the palate, which we'll go into a little bit, and that is now being slipped underneath into this area using a tunneling technique. And as the tissue is brought forward, it's actually pulled downwards in this picture, and the graft is tucked underneath. That's the epithelial, subepithelial connective tissue graft. And then ultimately that's going to heal and that's going to mature. So here is the clinical view of the steps involved. A small hole is created that is perfected into a tunnel where the tissue is carefully separated and advanced, and the graft is then tucked into the area, and sophisticated sutures are used to close things up. We always use a platelet-rich fibrin, which is the patient's own platelet that we harvest, we derive from the venous blood from the patient's own arm, and that we are able to yield platelets, and these cells bring growth factors to the area, expediting the healing. And here is a beautiful view of a 3 weeks follow-up after the surgery, showing how much of new tissue has grown in, how much of the tissue has grown, how much of the tissue has advanced, and how much of the recession is now completely gone, what we call complete root coverage. So diagrammatically, this is what happens. We gain the tissue from the patient's own palate, the roof of the mouth, and that is then put into the area of need for the purpose, and we call this the subepithelial connective tissue graft. The question that one has to ask, and of course the patients are always the one asking, is, does this hurt? How much does it hurt? Well, once upon a time, these procedures were one of the most uncomfortable procedures that was being done in practices like mine. But recently things have changed. This is a paper that was published in, I believe, 2023 by a group of very prominent periodontal researchers. And this shows a very interesting result. They looked at 4 different strategies of how to reduce pain and accelerate the healing in this type of situation, the roof of the mouth. And the 2 techniques that stood out the most, the green graph and the pink. The pink is clearly the best, and that is a physical stent, a piece of plastic that's covering the wound. And the green is the platelet-rich fibrin. That's the fibrin gel that we create, and then we literally dress the wound with this using sutures. So you can see the 3 bottom groups, especially the green and the pink, were good. The control on the top is not as good, but you can see it brings down pain almost 50% day 1, and in 2 weeks it sort of equalizes. In my practice, I've been using both platelet-rich fibrin and some form of physical coverage. In most of the cases, platelet-rich fibrin has been routine since about 2008, 2009. The covering has been used in most cases where applicable throughout the years. So pain is a thing of the past. It's really not something that our patients experience or complain about. So here is the actual site where the graft was done immediately after the surgery. And the next image shows the 3 weeks follow-up, showing an extraordinarily good healing. And here is the side-by-side view of this area, and again, a more of a matured area. How long would this last? I did mention earlier on, this is most likely due to heavy bite forces and the environment, the tissue, the bone, and the soft tissue just unable to cope with this heavy bite forces. So long as the bite forces are there and those causative reasons are there, is this not going to continue on? The graft is one aspect of the management. We also have to manage the occlusal disease. In this case, a careful analysis of how the bite pattern is, what kind of factors are causing this patient to bite harder, and in fact, a continuous management is being carried out by a combined effort of myself and the restoring doctor, her general dentist. In her case, she is wearing a retainer in the lower arch, and in the upper arch, we are providing her with a hard bite appliance. Take a look at this carefully. If you think the teeth are worn and the bone is damaged and the gum has receded, boy, take a look at this. This piece of hard acrylic is worn severely to the point where towards the back there are a couple of holes, and this is an image towards the front. A lot of wear. You see, this is the way we have to look at it. The damage is going to be there. We are practically unable to stop the bite forces, especially what we call the nocturnal bruxism, grinding at night, which is very common in cases like this. So having the patient wear one of these devices, and we can replace this as many times as possible, it's simply a matter of cost and the nuisance. But these can be replaced. Bone and soft tissue, and the 2 surfaces that physically wear and get damaged is very hard to reverse. Although in this case we did manage to reverse to a certain extent, This is the baseline in July of 2022. And this is 2 months after the surgery and how the tissue has healed quite nicely. And this is a 2-year follow-up that showed a very, very reasonable healing. So here it is, images side by side, the baseline 2 months and at 2 years. And I've added some lines just so that it can help my eyes zoom into where the issues are. All of the new tissue that's formed here isn't just the soft tissue. Given enough time, new bone will grow into the area, and research has shown that extensively. So here it is again, the before, with the root surface exposed, tissue thinning, tissue disappearing, and how we are able to turn it around to bring the bulk of the tissue back to make it as strong as possible. So here it is. This is one of the magic of what connective tissue graft, or specifically subepithelial connective tissue graft, one of the most commonly performed soft tissue procedures in the contemporary world, and one of the most commonly used application, and that is to get root coverage and to thicken the lost tissue. So here we are, another episode. I hope you enjoyed it, and I will be posting a lot more, so please like us and subscribe to our channel. And here it is, Dr. Jen Kim checking out.